What are the characteristics that a practitioner or patient should look for in an effective offloading device? And what are your thoughts on whether the FORS Insole in particular has those characteristics?
So it has to be able to have the ability to contour to the patient's foot, to selectively offload spots that are ulcerated or have high pressures. You are able to choose an insole that fits the patient's foot. You have to have the ability for that insole to fit into things that the patient is likely to wear. Surgical shoe, cam boot, cast walker, an offloading diabetic shoe. All of those things are addressed by the FORS Insole. And the FORS Insole is very easily modified to address patients. It's also very effective. I mean, we did a study at Temple, and we were just taking normal people, creating high pressure points, and having them walk around on the insole. And we saw upwards of about a 24% pressure reduction just with the insole itself because of the design of the materials. It automatically absorbs shock and pressure and contours to the foot. And that contouring allows it to shift pressure away from the ulcer to the rest of the foot surface. Then when we selectively removed the materials or the little pegs or pixelated sections of the insole out from underneath the ulceration, we were able to get upwards of, I think it was 54% pressure reduction at the site of ulceration, which is an overall 19% improvement by just pulling the pixels out.
My go-to is actually the FORS because I use that 90% of the time. The other 10% of the time I use TCCs. I like the FORS because, well, it's stable and it's easy to put on. You can pop those pegs out very easily. You can localize the pressure points. It's not time consuming to use. It only takes a matter of seconds. I like it, the patients like it. And I must say, one of the ways I get them to comply with it is I threaten them with a TCC. And they don't want that because then they can't do anything or go anywhere. And plus they have the fear of falling.
I mean, if you're going with a shoe-based system, I really think it's the best of all the insoles. It's a very simple insole to use, and it's made out of rugged materials, which maintain their offloading. The FORS Insole hold up a year. The materials it's made of make it very resilient. It absorbs the shock, but it doesn't mold or lose its ability to bounce back and then continue to absorb shock over time. That insole is a great insole. It just works.
Which patients do you think the FORS Insole, where's that your go-to solution?
I think patients that have forefoot ulcers, plantar digital ulcers, and maybe a fifth metatarsal base ulcer, and a shallow heel wound. The FORS Insole is a really good offloading device for those type of wounds. Harry and some of the docs that use these have gotten some pretty darn good results with some patients with some of these feet that give us real challenges and won't go into a cast.
So the bottom line is I like it on the digital wounds, the fat pad of the toes, underneath the metatarsal heads. It works very well. And as long as it's not a deep wound that you can see the joint capsule or the tendon. And it works well for shallow wounds on the heels. We've had very much success with that as well.
Are there patients for whom you would not recommend using the FORS Insole?
There are a lot of patients that they have to be seriously offloaded, and you can't run the risk that they're going to take it off or remove the device. So in those instances, they're usually deeper ulcers. They're usually ulcers with exposed tendon, sometimes exposed bone, capsule. Those are wounds that should be effectively offloaded with a non-removable device, whether it's a TCC or a cast walker.
Like Jim has mentioned before, that I would, if it's a deep wound, then I'm going to be using a TCC. If the wound's more shallow, say 0.2, 0.3 centimeters, then yeah, I would be using a 4. So my decision is based on the severity of the wound and the depth of the wound. 90% of our wounds are not severe wounds, so it would be the 4s that we're using.